co-hosted by Korea Health Industry Development Institute and North Chungcheong Province, and sponsored by Ministry of Health and Welfare. Good to see you all. Welcome to BioKorea 2020. I am announcer Park Seo-jin. And this platform is to provide information to investors with pharmaceutical, bio, and healthcare companies' comparative technology, as well as tell strategies and visions to investors. Now, let's learn about ImmuneMed. This company is working on antivirus as well as working on humanized antibody, and currently it got approval for medical purposes to treat serious patients. Let's listen to the presentation of President Kim Yoon-won at
Good to see you.
ImmuneMed. Thank you. Thank you for coming. A lot of people are paying attention on ImmuneMed, so please begin your presentation.
ImmuneMed is working on a new drug, namely virus treatment and inflammatory diseases and infectious diseases, especially acute diseases. We provide a therapy medical checkup device, and we are working on developing on this. And the core technology is, in terms of infectious diseases, we find out antigen and antibody to use them on therapy purposes. ImmuneMed currently has 39 staff members, and 9 of them are PhD holders. And our main focus is virus suppression. And this agent exists in our human body. Different people have different quantity and quality. So even if someone catches a cold or influenza, some people get infected, but for some people, they may catch it, but they do not show symptoms. But of course, their pre-existing immune system matters, but VSF is also another important factor. So far, nowadays, the coronavirus is a thing, and we recently got approval from the KFDA, and we are using this for medical purposes, and from June, we will begin our second clinical trial. In terms of this VSF, the characteristics of VSF is it has numerous characteristics on different viruses. It doesn't react to virus itself, but it reacts to virus-infected cells, so it can be used on different purposes. I'll move on to the VSF, which is our main focus. There are cells in our human body, and when virus comes into our body, and this cell tells I'm infected with this virus and sends out a signal. And once this VSF recognizes this, then it suppresses the virus, which has a very similar mechanism with this one. And this doesn't kill cells. Typically, an antibody is highly used for cancer treatment, but it's mainly focusing on killing the cells. However, we use this rather to spare virus-infected cells, and the half-life is about 25 days. When we take a look at the tested people and animals, we found efficacy on influenza type A on mice, ferrets, and dogs, and for influenza B or parrots and type B hepatitis, we found efficacy on woodchucks, and on those immunity system free mice, we used type B hepatitis virus infected on these mice. Then it generated this cell. So we conducted a study. And by so far, we did not detect any toxicity because it was pre-existing in the human body. So there is so far no side effects. And so far, if we generate 1 liters of cell, then we can secure 4 grams of this, and this is produced in the Lumsa company in the UK. Then what viruses can this be used? When it comes to this EMCV virus, it is highly toxic on animals, but it's highly less toxic on people. And this is a test. In vitro was conducted on cells, and this in vivo was conducted on animals. Typically, chemical drugs are highly effective on cell test, but shows very bad efficacy or side effects when it comes to animal tests. So it's really difficult to jump from A to B. But for us, this is based on what was pre-existing in the human body and animal body. So jumping from in vitro to in vivo, there was no difficulty at all. And typical chemical drugs are very effective on cell drug tests, and for animals and people, then the efficacy decreases. But for us, for animals, we saw antivirus and anti-inflammatory disease efficacy. And when only 1 out of 2 shows efficacy, then it can work. But for in vitro, we couldn't see anti-inflammatory, but only showed efficacy on antivirus. So for cell tests, it depended on virus or cell tests. We recently got KFDA's approval to use it as a group therapy, and it showed high efficacy for people, but for cell, it showed low efficacy, so we struggled a lot to get an approval. We're currently paying a lot of attention on influenza virus and in type B hepatitis. Well, we previously did pay attention on type C hepatitis. However, some company came up with a very efficient chemical therapy, so we gave up on type C hepatitis. And nowadays, recently, we are paying a lot of attention on coronavirus. So first of all, type B hepatitis, 2, influenza, pneumonia, and 3rd, coronavirus. So we were working on developing therapy on those. And this year, there was this coronavirus outbreak, so we became able to use it for medical purposes on patients. The VSF created by us is when we administer this to patients. In terms of VSF, if anyone can successfully come up with antibody, then we cannot use this. So when we conducted some research, Humula is the best-selling drug. It sells 20 trillion won per year. However, there is high side effects. They cannot come up with antibody for Humula. The lower the score is, the worse it is. And our antibody level was similar to Humira. So globally, the percentage or likelihood of creating antibody is like ranked in third place or so. And when VSF is administered in our human body, there is a side effect of creating T cell, then we should get rid of that side effects. So in the United States, there was a study using using blood of different ethnicities, and they administered VSF to see how much the T cells were activated. And 1 is the level when nothing was administered, and our ones showed 1.05, which is almost same as not administering anything at all. Typically, if a drug goes over 2 or 3, then that cannot be used as a drug. But for us, it showed almost administering nothing at all. So when administered with VSF, there is no side effect in terms of immunology. So that is our result. So that is the research that we conducted. This is the structure of VSF, which is similar to typical antibody structure. So we wanted to see if infected people's organs react to this. So we wanted to conduct a study. And those people with type B hepatitis, they tend to get liver cancer. So, and we studied on their liver parts. And this shows infected liver organ, and we administered VSF, and we could see a lot of reaction, and it applied for the type B hepatitis as well. And when we used this VSF and took a look at on liver cells, and this is not affected part and this is infected part, So it reacted a lot on infected liver cell. So after showing reaction, what happens? Do they keep stick to the cells or do they go extinct? They were stick to the barrier, and 1 hour later, the lysosome, which is like a trash can of the cells, this was put into this lysosome and got recycled. In terms of immunoglobulin, which is antibody, people think this is well known as a cell killer, whether it's killed by an antibody or killed by a complement. And the most commonly used one is IgG1. This is commonly used to kill cancer cells and for virus-induced cancer or those old cells, unnecessary old cells, so that normal cells cannot properly replace them. Then this is also used to kill cancer cells or old cells. So we use IgG1. But our main target is instead of killing cells, but we revitalize cells to get rid of the source of disease. That is our main focus. So for type B hepatitis, COVID-19, the coronavirus 19, infected virus diseases or inflammatory diseases can make use of IgG4 type VSF. From now on, I'll focus on the coronavirus. When the coronavirus infects mice, they all died in 10 days. If they're healthy, they survive, but if they got affected, they die in 10 days. And when we administered VSF, more than 70% of them survive. If we administer it a little bit late, but if we manage to administer well, then up to 70% of mice can survive. So this shows the weight of the mice. This is the normal mice's weight. And this shows a virus infected mice. So they all died within 9 days and their weight decreases. But when we administered VSF to these three groups, they regained their weight and most of them survived. So this result was very sensational to people. So the Korean FDA recognized the importance of VSF so that it allowed us to use this for medical purposes. So I think this data was the most strongly supporting data for the approval. And when infected with coronavirus, this chart shows cytokine level. ND stands for not detected, which means we can't detect it because the dose is so low. But when infected with the virus, there's a lot of cytokine release. So these are all inflammatory cytokine, but when administered with VSF, the level went back to almost normal. It decreased by 1/5 or even 1/100th or even lower. So this VSF, when you're infected with coronavirus, then your body releases a lot of cytokine and you release an overdose of cytokine which contributes to your death. But when administered with VSF, then there is no storm of cytokine. And for influenza pneumonia, this virus decreased and cytokine was suppressed. And immune system degeneration was also suppressed. And in terms of coronavirus, the virus secretion was suppressed. And the survival rate of mice jumped from 0% to 70%. And inflammatory cytokine was also suppressed. So we confirmed this based on our study. So we submitted this data to the KFDA and got approved. So this is the data related to the approval. We conducted this test. This wasn't the secondary clinical trial, but when a patient contracted a very serious disease but there's no cure and medical doctors and patients want to use this medicine and we, this company, want to provide with that medicine, then we can get Korean FDA's approval and we could administer this on patients. So this is for clinical trial. We completed the first clinical trial and we are about to begin our secondary trial, but we were approved to use this for medical purposes. When it comes to second clinical trial, then there is a control group. A clinical trial means we administer real dose and administer placebo on a different group to see if this therapy actually works. And so far, this was administered on serious patients. Those who do not get treated would eventually die, were the patients that got approved to use this. The age was mostly over 50, and there were 7 people, and 4 of them completely got rid of the virus, and 1 person almost got cured 100%. However, this patient previously had a metastatic pulmonary cancer, so eventually this patient deceased because of that. And in terms of clinical improvement, people would say, of course, they would improve, and that actually did work for these 2 patients. And for this patient, even though the virus did not disappear, but he improved, which means this patient had a type B hepatitis, but after this treatment, became a carrier without symptoms. Next is that this patient was confirmed negative, which means the symptom would clearly disappear, but in the early stage showed clinical improvement. However, we began this treatment too late, so the pulmonary system also already went fibrosis. So even though she got treated, because of this fibrosis-based symptoms, she suffered from this. And next example is, take a look here. Those patients with pulmonary system fibrosis, it's impossible for them to get 100% cured. Of course, they can get rid of the coronavirus itself. And for some other patients, they had bacterial pneumonia, and we did this medical checkup until day 14. So afterwards, I assume they got rid of pneumonia soon, but as of the time of this medical checkup and clinical the trial, they were improving but got worse symptoms. And those patients who previously had cancer, they got treated with this disease, but however they deceased because of the pre-existing cancer. Now let's move on to the future vision. So I mentioned there is a clinical trial in Australia. Some may ask, you already did a clinical trial in Korea, why in Australia? But in Korea we did one dosage administration, but in Australia many times. But in Korea we did IV injection, which is very difficult, but in Australia we did a hypodermic injection. In Korea we only conducted on males, but in Australia we did both on males and females, and did conducted on Caucasians and African Australians. And we worked on chronic type B hepatitis and influenza, pneumonia. And in Korea, we are planning to conduct research on Yeongnam University, Chungnam University, and Kaemyung University on 2 to 24 groups in terms of Corona-19. And I assume it will be the third quarter when we begin our clinical trial on 25 or more people of groups study, which will be done in August or September. And in third quarter, we will be able to use this for clinical medical purposes in Italy and in Korea. Probably in the second quarter or third quarter, we plan to conduct clinical research in Yeongnam University, Chungnam University, and Kaemyung University, and later on in Italy. And so far, currently, we are going under technology assessment in order to go public. And if we get passed on this, then probably we will go public in either August or September. Then you will be able to invest in our company. Thank you.
A research leader in virus inflammatory disease treatment. It was ImmuneMed. I wish this was very meaningful time for investors looking for comparative companies. Thank you for the presentation, President Kim. Through InvestFair, which connects investors and comparative companies, I look forward to seeing development of pharmaceutical, bio, and healthcare companies. And I have to say goodbye. Thank you.